Now, the Africa Center for Disease Control and Prevention chief says they are monitoring the development of Johnson & Johnson vaccine after few countries, including the United States, suspended its usage due to blood clotting effects. The Johnson & Johnson vaccine is among the number of vaccines used globally against the COVID-19 pandemic. And as we hear in this interview, Dr. John says his organization will give definitive advice on the situation as they keep an eye on its development.
Dr. John Nkengasong, thank you so much on behalf of CGTN. An incident has been heard from the United States about the Johnson & Johnson vaccination, and after a few people were reported dead and blood clottings have been heard after they took the J&J vaccinations, the US CDC and the US FDA have temporarily paused the use of this vaccination. Now, Africa, more specifically in South Africa, this Johnson & Johnson vaccination is being used. But what are you really reacting on the news?
We heard the news of the temporary pause for the use of the Johnson & Johnson vaccine in the United States. And this was realized after about 6.6 million people have been vaccinated. And out of the 6.6 million, 6 people developed a blood clotting. So the FDA and the United States Centers for Disease Control and Prevention thought that because of cautionary measures, they'd had to suspend this and investigate it further. If you look at the events, that is the 6 out of 6.6 million vaccinations, it is really some rare events happening, which would normally perhaps happen in normal settings there. So I think that is a recognition of that. The second thing we need to recognize is that it is a positive thing that the FDA and the United CDC, because of the surveillance systems that they have put in place to monitor people that have been taking these vaccines, were able to detect this extremely limited few number of people there. So I just want this to be very clear that it speaks to the fact that when we say in public health that we have systems that are monitoring people that have received vaccines, it is actually monitoring them. So that is a positive thing that has happened now. We'll wait in the coming days to see what the detailed analysis from the CDC and FDA will tell us, and that will determine the path forward. Maybe, and just maybe, in the coming days, they will say, we've looked at these events, they're extremely rare, and we provide recommendations that this vaccination should continue.
What is the recommendation in general terms from the Africa CDC side for the entire continent when it comes to the usage of this vaccination?
This is a rare event that we are looking at this situation carefully, and we will provide definitive guidance once we know more about it.